Good morning, everyone. Thank you, John. Welcome back. We are here at session 11 of our weekly Zoom call series. Thank you so much for those who have been with us since the beginning. Here's looking to you, Kathy, and so many more. And welcome if it's your first time. This is the first time a topic that we've covered has interested you. We're glad you're here. Today's topic, in fact, is about mental health and maintaining mental health during uncertainty. I don't even know if the word uncertainty is powerful enough to describe what's going on right now in our world, but of course this call is all about supporting people with intellectual and developmental disabilities in Arizona during the COVID-19 pandemic. So that is the lens we'll be looking through today, and our speakers are queued up and ready to go. We are so excited to have David Delaughter join us. He works with the University of Arizona's Department of, let me get this right, it's the Department of Family and Community Medicine, and he serves in many roles. He's a peer provider. He serves as chair of several community boards, including Nami in Southern Arizona, and the Protection and Advocacy for Individuals with Mental Illness Advisory Council. They're partnered with the ACDL and, of course, the Arizona Behavioral Health Planning Council. We're also happy to welcome Lindsey Zieder to our call as a speaker today. She is a very busy woman. She's here at our office all the time during normal times for meetings. She's really a great liaison between the developmental disability community and the behavioral health system here in Arizona. She serves as the Children's Special Projects Manager for Mercy Care. So welcome to both of our speakers. We're glad you're here. I'm going to hand things off now to David. Take it away.
Well, thank you very much for having me here today. And I'd like to start today the same way I start a lot of classes, if that's possible. So I would like to do a stretching and breathing exercise. It always gets me grounded before we get going. And I think a lot of us are spending times at computer screens for hours of the day. So if you are willing and able, will you be able to lift your arms up and just stretch out your spine? Feel it. Maybe take a breath in and then slowly turn to the left and gently go over. And then back up to the right, gently go over, back up, gently go forwards, and back up, gently go backwards, and then back up and slowly bring your arms down. Maybe roll your shoulders a couple of times. Forward or backward, and then just shake it out a little bit. And so I'd also like to just start with a breathing exercise. This is something that helps me with my own mental health, and it's called 4-7-8 breathing. And so what I'm going to do is I'm going to count to 4, and I'm going to ask that you inhale, preferably through your nose if possible. I'm going to count to 7, ask that you hold your breath, and then I'm going to count to 8. I'm going to ask that you do a really long, slow exhale through what they call pursed lips, like you're almost blowing out of a straw. So if you're willing to do this, and if you're comfortable closing your eyes, please do so. If you can have your hands in your lap, that would be ideal. And just take a breath in and out. And take another one in and out. And if you have any stress, pain, or tension, imagine it leaving your body when you exhale. Take another breath in and out. And we are going to begin. So inhale, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Inhale, 2, 3, 4. hold, 2, 3, 4, 5, 6, 7, exhale, 2, 3, 4, 5, 6, 7, 8, inhale, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, exhale, 2, 3, 4, 5, 6, 7, and 8, and resume normal breathing. You can open your eyes if you are comfortable. And thank you for once again allowing me to be here today with you. As it was mentioned, I work for family and community medicine here at the University of Arizona. And some of the things they do, just to give you background, is they have what they call 4 pillars: in education, clinical services, research, and then outreach. And so for my day job, I'm part of one of their outreach programs, which trains people to use their lived experience of being in a system of care, if you will, to help other people get through and navigate the system of care. It's very rewarding because a lot of people, in my experience, want to give back. And so this is a way to give back to people that have helped you. As it was also mentioned, I'm part of Nami, Southern Arizona, the National Alliance on Mental Illness, and the PAMI Council. And the other perspective I'm bringing with me here today is I'm a person who's been in the SMI system. So I carry that too. We were asked to talk about, how is mental health and COVID-19 affecting us? And so I have a couple of thoughts. I kind of want to go over the state of affairs, maybe some problems and strengths, some solutions that I think could help during this time, and then maybe leave with a call to action. So that's kind of the structure of my talk today. And I don't know if anybody heard the news reports on the radio this morning, but they were talking about certain populations at risk. And I can share this link when I'm done here. And the title of the article was "People with Intellectual Disabilities and Autism Die of COVID-19 at a Higher Rate," which probably doesn't surprise anybody here, but it basically found that you're at least twice as likely to die if you contract this disease, which is terrifying to me. And also, as most of you probably know, if you are in the SMI system, you die decades earlier than everybody else. And it's not from having any kind of mental illness. It's often from things like cardiovascular disease, respiratory disease, infectious disease. And I was thinking of what are the similarities of some of the populations that we work with? And why are folks dying so much earlier? And the report this morning, which was fascinating, was talking about people living in group homes. A lot of us have heard about nursing homes being a place where, it's easier to contract a disease, but the group homes that with the people that we work with and where they live is affecting their outcomes. And there's been reports as well that at a lot of these group homes, the people who work there or live there for that matter, aren't able to get personal protective equipment. And that's here in Arizona too. There was a report on KGA-ZZ, I believe. And so what are we gonna do about this? Well, also, as most of you know, everything has become a telehealth service, or through Zoom, if you will. And what I have noticed from where I work in my day job is that this has been fantastic for some people. And it's allowed some people to participate and feel included in society in ways that they didn't have before, which is amazing. But what I'm also seeing is that not everybody has access to Wi-Fi or hardware, or has been taught to even use any kind of information and communication technology. So there is a digital divide, and this pandemic is just highlighting that. And I think that's something that we all can address. I just wanted to also share a quick personal story. I grew up with privilege. I mean, I remember as a kid, we had an IBM DOS computer, and I learned how to use that. And when I was really sick about 15 years ago or so, and I didn't have much, my father decided to purchase me internet. And I already had the knowledge of how to use a computer. And it completely changed my life. I wouldn't be sitting here talking to you today if that didn't happen. And that's why I think that this digital divide that I'm speaking of, it's so important to teach digital literacy skills. You know, we are highlighting I'm talking about mental health, but we also know kids are now having to learn and go to school through this type of technology. And so depending on what's in their household allows them to do that. And so I was thinking about what are some solutions here? Well, I want to continue funding all of these telehealth codes. I think that is something that we could all advocate for, because it is helping a lot of people. And then more importantly, I think that we need to use treatment plans as a mechanism to make sure people have access to services. If you are in the SMI system, you probably have heard of the Arnold versus Sarn lawsuit, which resulted in, creating the Blue Rules, also known as Title IX, Chapter 21 of our Arizona Administrative Code. And in that, it highlights the rights of people with serious mental illness to have equal access to all existing behavioral health services and community services and any kind of generic services provided, throughout the whole state of Arizona. And I'm hoping that if anything happens after today's talk, the people that you work with who might be on one end of the digital divide, maybe they would want to write into their treatment plan that I need access because this is what is going on, and I'm a person who has vulnerabilities and comorbidities that if I catch this COVID, it could kill me more than other people. I think that's a valid argument. And of course, the Blue Rules also, outline the Office of Human Rights. They talks about the state, the protection and advocacy system, through the ACDL. And I also wanted to mention that Nami, Arizona has some great solutions too. Here in Southern Arizona, Nami has started something called Help and Hope for Youth. And it's our goal to bring mental health education into the schools by peers, people who identify as having a diagnosis or having something disrupt their life. And I think that's an exciting way to help battle some of the fear of this time we're living in, is to just be more accepting. And then one of the last things I'd like to say is, I think it's really important to make sure we're training more of our workforces to accept people with lived experience from whatever system you come from. I think we've all heard nothing about us without us. I think that needs to continue to this day, because sometimes the decision makers aren't people with the lived experience. There's great ways to learn how to advocate within our state. There's different places that offer trainings. NAMI happens to have one of those trainings. It's called NAMI Smarts for Advocacy. And you could contact, go to the NAMI Arizona website and ask about where a training is in your area, or see if they could schedule one. And then the last thing also to have a call of action, I believe, would be to make sure we're enforcing parity laws in this state. And by that, I mean, there's the Mental Health and Addiction Equity Act. There's of course, Obamacare, also known as the Patient Protection and Affordable Care Act. And then there's also the 21st Century Cures Act. And in each of those, there's provisions to make sure we're being treated equally in our health care. And I think access to services is something that needs to be enforced. I think that's the gist of what I wanted to talk about this morning. I'm really happy to hear from our next speaker as well. And I believe a question came in before we started, and I don't know when I should address that, Sarah.
Go ahead, yeah.
So it was a question about, well, what if somebody is just having, this coronavirus is making their symptoms worse, was the gist of the question. At least that's how I interpreted it. And what I can say is the most important thing when talking to people is to validate how they are feeling. I'm not a person, I don't know that my reality is any more real than somebody else's. So when somebody talks to me about something that's troubling them, I'm not gonna tell them that doesn't make sense. I'm gonna try to understand why this is troubling them. And then underneath all of that is usually some fears. And so then we can have a conversation about those. But validation by far is the #1 key in any kind of helping role, in my opinion. Thank you.
Thank you very much, David. We had one question in the chat pop up asking about if people want to get in touch with you. Do you welcome that, or do you have somewhere you want to send them to get in touch with you?
Yeah, do you mind if I just type my email address into the chat box?
That would be great.
Yeah, I love to talk to people. Make sure I spelled it right though.
And I will continue to monitor the chat. If more questions pop up for you, I'll make sure to alert you as we kind of move on today too.
Okay, thank you.
Good morning. This is Lindsey Zieder with Mercy Care. I hope you all can hear me. I apologize this morning for not being able to have video. I wish you all could see me, but I'm incredibly thankful to see some familiar faces right now on Zoom, and looking forward at some point to meet all of you or connect with all of you again in the future. So I'm incredibly excited to be here today to talk about Mercy Care's commitment to the community during our current pandemic and our commitment to the DDD population that we serve statewide. To start off, and Sarah, thank you so much for the introduction earlier. Again, my name is Lindsey Zieder. I am the Children's Special Projects Manager here at Mercy Care. I've been with Mercy for roughly 5 years. Previous to the integration with Mercy Care, I worked for our Regional Behavioral Health Authority, which was Mercy Maricopa. So I'm privileged to be here today to talk about some of the behavioral health services that we are offering via telehealth, but essentially how we're supporting our community in a really unique time during this pandemic. David, I'd like to thank you so much for that stretching and focus on our wellness. So I don't think we realize sometimes the stress that our body carries and how we're harboring some of that, especially during this unique time of finding ways to express how we feel. And so I really do appreciate connection with our bodies and connection with our emotions and our feelings. I also want to thank you for the beautiful perspective that you shared of members and families and our experience right now through the pandemic and how critical it is to focus and listen and hear what our community is going through. So thank you for that. This morning, I plan to talk a lot about Mercy Care's commitment to our community, but also how we leaned into this national emergency really these last couple of months and future forward, as we focus on the safety and well-being of the members and families, as well as our support staff and stakeholders within the Mercy Care network. Mercy Care is always dedicated to delivering the highest quality and outcome-based services for our community, but specifically our DDD population. We have a comprehensive provider network that has committed to focusing and shifting efforts towards our telehealth platform that we've adopted and moved forward with over the last couple of months, and have been very open and honest with feedback from our members, from our providers, from our stakeholders, as we look to always adopt our platform to meet the needs of those we serve. We focused some of our areas or some of our efforts on a few pieces that I'd like to share with you guys this morning that is not really encompassing all of what Mercy Care is focusing on, but I think it's pretty critical to share this morning. We look to incorporate different strategies for engagement. So as David was talking earlier about ways that we can look to engage members and families and community members in regards to telehealth, I think that's pretty critical for us as a health plan to listen and hear how we can adopt the way that we deliver services and the way that we tailor services to the community. So we've really committed ourselves to looking at new engagement strategies. We've also looked to implement different models of care or best practices. So we've looked at different state regulators, different providers, again, and community members to help us identify what's the best approach for us to crosswalk individuals over to a telehealth platform. It's not easy to do, as David shared, and it's not something that's accessible for everybody. So we really wanted to ensure that we had the best models and the best practices in place to make sure that there was a successful transition. Lastly, looking to maintain a network to sustain telehealth. And so I think that's a lot of concern we've heard from our community. Again, various levels of family members, caregivers, individuals that are receiving services from Mercy. The concern really has been, what is telehealth going to look like in the future? And so I'll talk about that sort of throughout the course of my presentation this morning. But just to sort of backtrack, as we talk about the transition to telehealth, it's been a rough start several months ago to transition individuals over to a telehealth platform. We have been successful in transitioning our in-home community and clinic-based services over to a telehealth platform for existing members, but then also new membership. And so it was really critical for us that we supported our network to say, yes, indeed, we need to continue to support those receiving treatment for continuity, but we also need to make sure with the evolving needs of our community that we can serve those that are coming forward and saying, I need some additional assistance, can you help me? And so we really were trying to find ways that we could incorporate new membership within the model as well. And I think we've been pretty successful. However, we have opportunities for growth there as well. We've committed ourselves to engage in regular communication, ongoing screening and assessments, which are pretty critical for us, again, as there's some evolving needs and different experiences we had throughout the course of this pandemic. Several of our providers utilize different screening tools and assessments to manage the network. A couple of those involve a parenting stress index, so it's important for us to connect with our parents, our caregivers, and our teams to really assess the stress throughout this pandemic and what everyone's experiencing. So we have looked to increase the use of this parenting stress index tool, but we've also looked towards social determinants of health. So before we can encourage connection with the treatment provider, we have to make sure that the basic needs are being met, and that includes food insecurity, housing insecurity, and wellness currently through this time. So we've really looked pretty strongly at our social determinants of health screening and check-ins with individuals. Along with that, we've looked to increase our depression and trauma screenings. We've also looked to increase our substance screenings as well as our housing and placement. Again, based on housing insecurity, making sure that we're assessing throughout treatment, throughout the course of care. As mentioned previously, and David did a great job of this, telehealth can be incredibly difficult for members and families to participate in. And there's various reasons for that. And we've committed ourselves to help offset some of the concern by adopting different HIPAA platforms. Several of us have utilized Zoom, LifeSize, FaceTime, Microsoft Teams, different platforms that have allowed us to connect with families that have different technology uses, maybe smartphones, tablets, whatever it may be. We've looked to our provider network to adopt as many platforms as we can to make sure that we can connect with those that's most feasible. We also, I'm not sure if many of you are aware of community reinvestment with Medicaid health plans, but we currently have community reinvestment funding in a yearly plan we work on with Access that focuses on reinvestment into the provider and member network. So we have committed ourselves to supporting and reinvesting in over 44 agencies since the pandemic started. to help, again, offset some of the cost of some of the things we've seen within the system. So as I talk right now about telehealth, we've actually committed ourselves to purchasing phone cards to help offset the cost of telehealth, as well as different items in which we need to purchase for families and providers to make sure telehealth is accessible. I'll sort of talk throughout my presentation this morning about CRI or community reinvestment, but if you have questions, I'd be happy to answer that as well. Lastly, we continue to collect feedback from our provider community to meet the unique needs as we look towards targeting certain parts of the state of Arizona during the pandemic and collaborating with Access to share feedback solely from our members and our providers to make sure that we can sustain services post-COVID. And that's something I'll talk about as well. David, you also mentioned the need to focus on understanding technology and use the language digital literacy. I think that's critical, and I so much appreciate you sharing that. And this is an area in which our family and peer runs, Nami as well, have committed ourselves to focusing on developing and teaching ways and how-to guides to utilize telehealth and understand the technology platforms for it to be successful on both ends. So thank you for sharing that. As I jump into feedback real quick, we've received various levels of feedback, and we have different listening sessions that we offer the community that I'll present later on today. But we've so far received some really great feedback around telehealth that I just want to share real quick with the group. With the use of telehealth, we've received feedback from our case managers, care coordinators, counselors, and various direct care staff within our community about the flexibility in their day to better manage caseloads, connecting with teams, but it being more meaningful. And I think that's the piece that I continue to walk away and feeling really great about is the meaningful engagement that I've heard from families. They've also used language of services being less intrusive, right? So it being more meaningful, connecting with me on what I need when I need it. And I don't have a lot of folks in my home, but I have a lot of folks that are there when I need that. So I really do appreciate that feedback. I think it's great for our providers to hear. And they've also shared we've seen higher levels of confidence in members and families implementing, but also directing and advocating for treatment. And that's been incredible for us to get that feedback around telehealth. Providers also report great success in continuing the services via telehealth. A few examples of that in some of our services include, and this isn't a full list of our services, but I just want to offer a couple this morning, one of which is our applied behavioral analysis or behavior modification programs. So for many evidence-based models, maintaining fidelity to the program is critical when we look at increasing adaptive skills, when we look at reducing complex behavior for the individuals that we serve and care for, but also focusing on the evolving needs of our members and families during this time. We've had providers incorporate different formal evidence-based parent training programs via telehealth and in person, allowing families to utilize different PowerPoint teaching opportunities as well as pre-recorded videos to help customize treatment for themselves. If they feel they want to focus on a certain area, a certain goal within the treatment that's being provided, they have the ability to customize what that may be based on the evolving needs of what we're seeing. Although a lot of our services are offered via telehealth, the majority of our services are still maintaining in-person, in-clinic, face-to-face sessions, which is pretty critical. Again, as we talked throughout today, telehealth really isn't a platform that works for everybody. So we really encouraged our provider network to maintain safety and to maintain face-to-face clinic-based sessions or in-home sessions as deemed appropriate. Several of our in-home behavioral health and behavioral-based programs have taken additional steps to maintain safety for the individuals that we serve in order to reduce transmission. So staff continue on their end to conduct regular screening checks of themselves, decrease potential exposure, and maintaining personal hygiene before, during, and after sessions. The majority of our in-home service providers have also decided to place different cleaning bins within homes, as well as different PPE equipment to really, again, maintain safety for all of those involved, but to really make sure that we're not having a disruption in service. As I mentioned earlier, this is another area for our community reinvestment funding that we've been able to reinvest within the community. We've purchased over $29,000 in masks and distributed that to our provider community, as well as cleaning supplies for our direct care staff. So it continues to be our commitment to the community through the use of our reinvestment funds and finding ways that we can continue service delivery and maintaining safety for all involved. Another area, another service that I want to highlight today is our different counseling programs. So we have a variety of counseling we offer for both children and adults within the system. Some of those include our trauma-based counseling programs, our traditional general mental health services, our specialty services, including birth to 5 and family-based counseling programs, as well as substance abuse counseling programs. So we have quite a few of those that have continued to maintain in-home and telehealth service options. So our family and individual counseling programs have decided to shift to shorter, more frequent sessions to accommodate members' individual needs that may align or may fall into areas such as shortened attention spans or maybe environmental distractions that historically may cause some disruption in telehealth. We've been able to adjust and uniquely meet the needs of the members that we serve through our counseling programs. Again, still face-to-face options with PPE is still offered and deemed appropriate as the families and members choose. We also, just in relation to our health promotion programs, we continue to offer those via telehealth and in person. I've had a couple providers reach out and share some really unique ways, and they've been able to focus on wellness, and some of them are exciting to hear. We have some of our providers and individuals engaging in virtual walks together, exercise classes. We have quite a few providers that are offering exercise, yoga classes, which is really great to participate in. We have art journaling classes that we offer. Even here at Mercy Care, we facilitate a couple of those groups. But then we also focus and see the need for continued sensory play. So several of our providers have committed to weekly drop-offs of art supplies to our members and families and utilizing telehealth or FaceTime just to connect. And sometimes that's all we need right now is just connection and someone understanding what we're going through and really what all this feels to us, and utilizing some of these expressive outlets to share with each other. We also, for some of our families that took a break, along with myself, with our education system, our providers have focused on developing routines for families still to make sure we're allowing sensory breaks, make sure that we're focusing on physical regulation for some of our young folks, but then also online education platforms still throughout the course of summer. So I know for myself, I have a high schooler and now a middle schooler, and summer is really unique and the end of school is really unique. So finding ways to maintain routine, connection, but then focusing on movement and skill building really has been a focus for all of us, whether we're in services or not. Just being a parent and a caregiver, I think we're trying to figure some of that out. Lastly, one service I want to talk about today is our family and peer support, but then also some of our respite services that we're providing. So our family and peer and organizations, again, have utilized telehealth. I think that's the common theme today, is we've adopted and we've moved forward as quickly as we can with telehealth to make sure that we're offering virtual support for those that are seeking that connection. If face-to-face, if there's some fear with face-to-face or exposure, as I'm sort of hearing, as David mentioned, some of our families have mentioned, we have an option just to connect via telehealth or via phone and just check in. How are you? Let's make sure that we connect with those that we can relate to, and that's some of what our support groups are focusing on. We're offering training and different resources that are focused on education, some of our basic needs, as I mentioned earlier, are social determinants of health, making sure we're focusing on food insecurity, focusing on unemployment, public health benefits, but as I mentioned earlier, and David, focusing on how-to guides of telehealth. I think that's something we're still all trying to figure out, even as professionals, families, caregivers. How do I call into Zoom? How do I make sure I'm not echoing? How do I make sure I'm on mute? I'm not. I mean, these are all things that we can all relate to. And we're all experiencing this together. And so it's been great to see some of our family and peer runs offering these skills, offering these trainings via telehealth, in person, how-to guides, to make sure we all feel comfortable with the new normal, right? And then even offering tools to make sure that we can access affordable broadband at home. I think that's something we're all sort of struggling with. And so our family and peer runs have taken steps to move that direction. They also play a critical role in fostering health and wellness for our families with special needs. And again, this is an area that our community reinvestment has focused on pretty strongly. And so as I mentioned, food insecurity, we have roughly 9 peer and family-run organizations within the Mercy Care network. We have committed to offering over 1,000 grocery cards to all of our families and individuals that are in need, and we continue to see the growing demand as we continue to align with our funding to make sure that we can support our families with food insecurity. We've also, again, have offered different funding to different community-based services and even childcare facilities that continue to remain open as we, as parents and individuals, still have to work. We have committed ourselves to supplying cleaning supplies to all of these different various levels of supports for our kids and for the ones that we are caring for. Lastly, I hope many of you know that Respite Services have increased to 720 hours to be able to provide additional support to those that need a break. And so the respite hours have increased to 720. Our providers are offering this still in-home. Majority of our facility-based providers have actually transitioned Respite Services home. And there's some collaboration with Access right now to see what telehealth respite may look like. But in the interim, we're still providing those face-to-face services as needed, which are incredibly important during this time. So lastly, I just want to wrap up with some resources. I shared a lot of information. Please feel free to reach out. Please feel free to use that chat box. We're here to support you, here to talk through this in any way possible. But lastly, a couple of resources I wanted to share. DDD and Access have incredible COVID resources and FAQ website that I would encourage all of you to view, to access, to read along as these questions continue to come, as decisions continue to be made, but then really just to connect with some of our larger state regulators. I would strongly encourage you guys to view those web pages to follow along. However, for some of our Mercy Care members or Mercy Care providers on the phone or Mercy Care advocates, I would also encourage you guys to review our dedicated COVID resource page that highlights our different crisis teams that are available. We still are offering face-to-face crisis services 24 hours a day, 7 days a week for all of those that need crisis intervention or support. We also have a list of helplines, warm lines, our Access and Mercy Care OIFA information, which is our Office of Individual and Family Affairs, a great group of individuals that can support and connect you with service providers across the state. We also have a list of resources to focus on fostering resiliency and reducing trauma. We also have resources focused on stress management and then education activities for children and adolescents. For many of the providers on the phone or individuals that are curious on resources and FAQs for providers, we also have a link on our webpage for you as well. We also offer both our Mercy Care and DDD have different community feedback and listening sessions I would also encourage you guys to participate in. DDD is currently hosting weekly forums for providers, individuals, just to connect and hear some of the updates as DDD is rolling those out pretty frequently. It's really great just to connect and hear about some changes, but then also to connect with the community and hear about some questions and concerns and just to support each other. So I would strongly encourage you guys to call into some of those weekly forums if you can. Mercy Care also hosts weekly listening sessions. So we've had 3 already and they've been incredibly successful. I would encourage all of you again to call into those. More to come though on the dates. So we plan to post on social media and our website when we plan to have some more listening sessions, which will be coming up really soon. So please, we'd love to hear you, love to hear some suggestions, love to hear your concerns and your feedback as that continues to shape who we are as a health plan committed to serving our community. We're in the process now of planning post-COVID. So again, we're collaborating with our networks, you as our members, as our communities, as our advocates, but then also Access on lessons learned through this pandemic, through the transition to telehealth and through the pandemic. There's opportunities for us to strengthen and opportunities for us to maybe change. And so with the voice and with the feedback, we continue to present this to Access and really what life's going to look like for all of us post COVID. So we have several recommendations out to access now. Some of those include the codes that we can currently bill with the telehealth modifier. The majority of our providers would like to maintain that. And so I think that makes sense to a lot of us that we have moved pretty quickly in the telehealth arena. We don't really want that to change, is what we're hearing from the providers and families, and that's critical feedback that we've been able to provide access. We've also are currently focusing on some recommendations around verbal consent for treatment instead of just written consent, making sure that if someone agrees to a treatment over the phone, that we can pursue treatment recommendations from there. But then also, again, finding different ways to sustain telehealth, whatever feedback that may look like, whatever recommendations that may be. We have a lot of conversation with Access, who has been tremendous in rolling out a lot of changes, moving pretty quickly in this arena. Lastly, again, I would encourage if there's any questions, any concerns with the services you're receiving or not receiving, or seeking additional information and guidance as you're a Mercy Care member or provider, please reach out to our member services. On the back of your insurance card, you should have our number. Please reach out, please provide feedback, ask questions, bring up concerns. You can also outreach our OIFA team, again, our Office of Individual and Family Affairs. Their information's on our website, or even myself today to discuss ways Mercy Care can support you, your family, and your loved one. So thank you all again for the opportunity this morning. I look forward to connecting with all of you, and I sincerely appreciate the opportunity to present today. Thank you.
Thank you very much, Lindsey and David, for sharing with us this morning and spending time talking about a really important issue. I think I'm just reflecting, listening to you both speaking, how y'all are aligned and saying a lot of the same things, but you approach this with two pretty different frameworks and perspectives about communicating and talking about this. And I think that's a real strength for people on the call right now to hear from different people. So we're kind of reaching a point where we're going to turn to some questions and comments and stories from people on the call. I just want to remind people that we welcome those to be shared verbally or in the chat. If you want to share verbally, you can use the raised hand function by clicking participants at the bottom of the meeting screen and then the raised hand button. If you're on the phone, you can dial *9 to raise your hand. And when you raise your hand, you pop up to the top of our screen and we'll unmute you and you can share. I also want to welcome and comment that if you share questions or resources or stories in the chat, we'll make sure that they'll get read out loud for the people on the phone and also the people on the call. So I don't see any hand raised now, but I want to kind of go through some of the things that have been happening on the chat. So we had a question from Liz while Lindsey was speaking about if the information could be provided written down or in a PowerPoint, and Sarah was helpful enough to indicate that after this meeting, we'll work to compile that into a more shareable format so people can process and read those at their own leisure. Donna from Nami of Southern Arizona shared, we will be lending laptops to people who want to participate in family support groups and peer-to-peer classes. Virtual support group meetings begin this week. The virtual peer-to-peer courses will begin this month. We are evaluating using Zoom for educational programs we offer. And then we did have a follow-up question about how the family support works regarding that comment for Nami, Southern Arizona. I'm not sure, David, are you able to share a little bit more, or is that information on the website too?
Yes, going to the website would be a great idea, but what Nami offers a lot of services, and it revolves around education, support, and advocacy. And one of their, really the class that started Nami on a national level was something called Family to Family, which is an education course. It's 2.5-hour sessions, and there's 12 different sessions, and it's usually spread out over 12 weeks. And one of the things I've noticed about the family support groups that I guess I didn't have this perspective coming into NAMI. I knew that people who live with different illnesses often have isolation as part of it. It's a symptom. And the families are just as isolated. And I don't know why that had never occurred to me. So what I see in the family-to-family classes is it's a really good place to connect with other people like yourself. It's, you know, peers. And what do they teach in the family-to-family class? Just a lot about different illnesses, a lot of communication strategies. It's an excellent course, and you go through a binder that's massive. And then NAMI also has different support groups throughout town. And this would be in the Phoenix area and all over the whole state. There's 13 affiliates, I believe, in Arizona. And the family support groups are like they sound. You go to them, you know, maybe once a month, and you get to relate to other people just like yourself who are going through the same kind of struggles. It's not really, I don't see NAMI services being duplicated by any other provider, if you will, because NAMI takes anybody. You know, you don't have to have insurance to take these classes. You don't have to have any kind of certain status to be able to take them. So it really is open to the community, and I hope that answered some of the question.
Thank you very much. This person who asked that question, Margarita, also shared appreciation for some of the laptop and virtual meetings that NAMI is working on. Also, while Lindsey was speaking, Liz shared some links to the DDD weekly town halls. That was some of the feedback sessions that Lindsey was talking about. And then there was a question similarly wanting to get Lindsey's contact information, which she just shared in the chat. Someone also shared a link to some more NAMI information. So we want to hear from our group. What are some things that you've heard today from the speakers that are sitting with you? What are some things you have more questions about? Have you had experience with telehealth post-COVID that you want to share, positive or negative? Have you established routines, or do you have questions about coming up with routines to help with mental health or challenging circumstances? Are you feeling the digital divide that David spoke about? Are you feeling not connected enough? Are you feeling too connected? You know, it can go both ways with that. So those are some of the open questions I want to put out there. And I welcome folks sharing either in the chat or raising their hand. All right, I see a hand up from Kathy. Kathy, I'm going to unmute you now.
Yes, thank you, David and Lindsey. I have a question for you, David. I have a daughter with an intellectual developmental disability, and then I have a son who lives with bipolar disorder. And I went through the family-to-family course years ago. It was wonderful. A small group of us that really supported each other, you know, and like you said, the sharing of ideas, techniques, you know, that can be helpful. And I might have missed this because I had to step out for a moment, but are they doing any like Zoom support group meetings for family members?
We in Southern Arizona, we are. Each affiliate's a little bit different. The Southern Arizona affiliate was the 4th affiliate out of all of them in the whole country. So
oh, wow.
we've been very established down there. And you know, while we're primarily a volunteer-run organization here in the South, we do have paid staff as well, and not every NAMI has that. So they have a phrase in NAMI: you've seen one NAMI, you've seen one NAMI, because they're all a little bit different. But because of the fact that we're doing stuff online now, would mean that the reach would be much bigger. You know, people who live in Flagstaff could come to take a support group meeting with people in Tucson because of Zoom. So I think as tough as this is on everybody, I think there's a lot of opportunity here as well to make some substantial change.
Awesome. Thank you.
So we have some action in the chat. Donna shared that she teaches the family-to-family course, or they've taught the family-to-family course. They've seen people walk in completely defeated, no hope, frustrated, and 12 weeks later, the same people walk out empowered, have hope and resources. Margarita shares, I found that my young adults are struggling without social interaction. My daughter's mental health has greatly been affected. Any suggestion on how to improve their emotional state? She has depression and anxiety. And then Gail is asking about times for the session. But I'm wondering if any of the speakers or anyone else in the call have any kind of response to Margarita's comment about particularly young adults and strategies for working with young adults who are struggling without social interaction.
I think for me, it goes back to validation that these feelings are there, and then talking about them. That's really, and talking about them in a kind of in a judgment-free zone, which isn't always easy with family. But I think that's the key, is having those connections with people and understanding that these, whatever they're struggling with is real. And acknowledging that is very important. Lindsey, I don't know what your take on that is.
I would agree 100%, David. I think recognizing that we are all in this space of struggle, but then what that connection looks like with our existing support network and how we continue to maintain that network, especially for young adults, adolescents, having that connection with friends, and then having this physical distancing in place can be a bit of a challenge. I know our providers have also committed to continuing to focus on ways that we can utilize support groups, peer support groups, or bringing together some individuals through a group format, whether that is a telehealth platform, Zoom, just to connect and say, we're here, we're in this together, we all feel the same. How can we support each other and lift each other up through this physical distancing? Many of our providers have taken the initiative and commitment to focusing on connection and social interaction. So I would encourage, if you're connected to a provider, if you're the person that you're caring for, your daughter is comfortable and just connecting via telehealth, just to listen and hear how other community members are handling this and other individuals are handling. That may be a way just to validate some of her concerns, some of her depression, but then look towards connection when she's ready.
Thank you.
And I had mentioned Help and Hope for Youth. They might want to reach out to that organization because there's youth involved in trying to change the schools, and they relate to those struggles of depression and anxiety. And so, I mean, often just meeting other people going through what you go through can just feel so much better.
So I'm going to go back to the chat in a minute, but we have a hand raised from Charmaine. So Charmaine, I'm going to unmute you now.
Hi, everybody. My name is Charmaine Dorson. I work with the Arizona Rehabilitation Services Administration. We administer the state vocational rehabilitation program. My role within that organization is a statewide developmental disabilities coordinator. So thank you guys for all, hosting this call. In regards to the question about, things that are available to young people, there are some services as well within the employment services realm that we offer to youth in order to prepare them to be in competitive integrated employment. Now, right now, we know that, beginning that process, of course, they're not immediately going to get a job. It may take some time where they're need to be involved in preparation services. So VR does offer those as well, and DBD does have employment services. So there are some key differences in how we administer them. The main difference is going to be that all text. So if you have a youth that does have support by all text, they can receive employment services from both DDD and VR, kind of depending on what their necessary goals are. One service that DBD has available for all text members is called TTE. I'm not sure if Margaret or any of the other DDD Employment Services reps are on the phone, but basically with TTE, I believe that the minimum age is 16. Now with VR does also provide pre-employment transition services and some other services. And we start working with youth at 14. Now with VR, it doesn't matter if they're all techs or not. So that's really important for those parents on the phone that have members that are DD only or targeted, because VR can help provide some services for them, again, within that employment realm. Now, VR has moved to telehealth or teledelivery of our services as well. And I know that there are some DDD services as well that are going to teleservices. So in terms for youth, as far as, what they can do in these times to not just, do the same things around the house every day, that could be something to look into, because it gives them, goals and other things to work on outside of that. So I just wanted to throw that out there. With the families, the first thing to do is start that conversation with your support coordinator. We have worked out a smooth referral process between DDD and VR, to where, they're working with the employment specialist a lot more smoothly now. So if anybody has questions, I can drop my email in the chat, and feel free to reach out if you have anything.
Thank you very much, Charmaine. I appreciate you sharing your voice and your perspective on the call. I don't see any other hand raised right now, so I'm going to catch up a little bit with the chat. So we've had 2 comments kind of on this theme of using telehealth and technology training. So I want to read both of those. Hannah shares, I have had a number of elderly folks struggle with accessing telehealth because of a lack of patience from providers. Many appointments are canceled because they did not know how to text or use their cell phones very well. I would like to see more training opportunities available before people are signed up for telehealth appointments. And Liz added on, training for providers would be beneficial as well. Many providers are not skilled at using telehealth or webinar formats. So I don't know if there was a question in there, but if anyone does want to respond, I know that that was something that Lindsey talked about, and David too with his digital divide.
I can just say for my day job, preparing people to take classes online is a completely new skill set in teaching people how to create a folder on their desktop to save things into. And I think it was mentioned having a lack of patience, because yes, it takes a long time sometimes to walk people through this process. And while I can't speak for a lot of provider organizations, I can say my experience of being in the system was that often you didn't get that time, and people wouldn't sit there for an hour and a half and just go through it. So I think if you have complaints about that, using the grievance and appeals and calling the complaint lines would be a way to start, because you're entitled to receive the services that you want. Anyway, that's my take.
Thanks.
Nick, I was wondering if I could add something here.
Go for
I have
it.
I have a stepdad in an assisted living facility right down the street, and it would take about 10 minutes to walk there. And in the last 11 weeks or so, we haven't been able to have any contact. We can't even go outside anymore, and understood completely as to the reason why. But they just started doing FaceTime, at least as the connection side. And I'm sure everyone's experience is the same, but it takes a lot for that individual to get used to what that means to hold an iPad, not put their thumb on the microphone, not cover the camera. But it's that one opportunity for us to connect, and they're going to continue that sort of thing. So it'd be interesting to know or to see how assisted living facilities are dealing with that digital divide on the training for providers and for the individuals that are inside the facility. So I just wanted to share that. But we've been having a blast with the FaceTime side.
Yeah, John, thanks for sharing. Donna shared in the chat as well, I think, a similar theme to what you were just discussing. She writes, or they write, my mother is 97. She lives in an assisted living facility on lockdown for 2 months. No one is allowed in, and the isolation is beginning to take her toll on her. Are there programs, other people here in her situation? Can someone be assigned to visit with them, to take a walk around? Is there anything that we can do to get them out of their rooms? And I know at least the answer to one of those questions, are there other people in that situation in this call? Definitely. Looks like Sarah shared a link to the Family Involvement Center. Might be some resources there. There were some discussions in the chat about the family-to-family classes. And so I encourage people to check that out if they have questions about scheduling or other questions around that. Erica shares that one way that answering Donna's question, she's been sending her mom letters, books, puzzles, care packages. Doesn't really get at the in the room connection, but finding solutions around that. There was a question, Margarita asked if anxiety and depression qualify you for DDD or VR services. I don't know if anyone is able to answer that question. I suspect it might be more complicated answered than asked.
You could qualify for VR services, and I'm sure Charmaine could actually address this the best. But yes, if you're involved in the mental health system, you can get to VR. And if you are in the SMI system, if you've been determined to have a serious mental illness, at least in my experience, it kind of puts you at the top of the list.
So yeah, there's some comments suggesting not with DDD, but yes to VR. Kathy, I see your hand up. I'm going to unmute you now.
Yes, just to follow up with John was talking about the FaceTiming, and I was thinking of Margarita and other parents and actually children who are taking care of older parents. FaceTime has been a godsend for my daughter Kelly, and we schedule a weekly visit with 3 of her friends that happen to live out of town, 3 of her best friends that live out of town. And we put this on her calendar so, you know, she has stuff to look forward to. And then once a week, we go visit her roommate because she's been living with us for almost 3 months now. And I know that's hard, living with mom and my husband, but we go and take her dog and wave from a distance, of course, to her roommate who still is at their apartment. But the FaceTime for the other friends, and we've scheduled a time when it's available, you know, her friends are available, and it's been wonderful. Just, you know, she knows what day she's going to talk to Allie or Jennifer, and so on, and that's worked really well for us.
Thank you for sharing. So we have some links being shared for a few other virtual support groups, one for caregivers taking care of parents, which I think echoes some of the comments David was making about how it's not just, it's the persons and their families that are feeling the isolation together, just like I'm sure caregivers might be feeling that to a certain extent too. Erica shares, some residents aren't allowed to leave rooms much due to COVID. Some long-term care residents aren't even allowed to eat together. So you have to get creative to get people engaged and not depressed. Some states have started pen pal programs for group homes and long-term care residents for people who don't have access to technology. And Gail shared some appreciation to you, Kathy, because you're always sharing in these calls and I think building a community around this group. So thank you. Are there any other creative things that people are doing out there from the call that you want to share in the chat, or you want to raise your hand by clicking raise hand or *9? Donna shares in the chat, I take her things she likes every few days and call 2 times a day, but it isn't enough. The employees have their hands full and no time to do the extra socialization our elderly need. Many in the assisted living community that are elderly do not understand the technology for FaceTime. They need personal interaction. All right, I see a hand raised from the phone. So the phone number ending 3745, I'm about to unmute you. You need to make sure that you're also unmuted on your phone if you've clicked a button on your phone.
Good morning. It's a wonderful chat today, and unfortunately for all that are giving their emails or contact names in the chat, I'm on the phone and have no way of looking at that. Would you please tell me how to get the contacts for each person?
Absolutely. So when you registered for this meeting, you entered an email address to register, even if you didn't join today.
Yes,
And
I did.
after the call, it might not be today, it'll probably be in a few days. We'll email everyone on that list, and it'll include a recording to the meeting. And when you click on the recording link, it'll also have the chat transcript available. So you'll be able to go back and get it. I also encourage you, Sarah at ADDPC is keeping a Google Doc that maybe she can share the link to, that I know she tries to keep updated from each of these calls for resources and information that's shared. So those would be the 2 things that I would suggest. I don't know if you have anything more to add, Sarah.
Thank you so very much.
Yes, and ma'am, what was your name again? I can send you a right after this call with our speaker contact information.
Okay, my name is registered name or the email address?
Just your first name's fine.
Oh, Sharon.
Perfect. We'll get that to you, Sharon. And I will make sure right after today's call to update our Google shared Google Doc, because I think, especially for today's topic, it's just really important to share these resources as soon as possible. I'll go ahead and put that link in the chat box so that you all will have that right away. And we'll make sure to update that shortly.
Appreciate it. Thank you.
Absolutely.
Thank you very much. So some comments in the chat. There's Gabriella shared some information about a Spanish parent support group, GANE, happening on the 29th at 6 p.m. Sarah asked for some more information about that, so maybe we'll see a link. Hannah shares, direct care for independence has delivered huge packs of general, quote, thinking of you letters, unquote, to nursing facilities, and we all could do more of this. Who would have thought in this age of digital divide that we're writing physical letters again, right? So we have about 5 more minutes until we're gonna start to wrap it up. So I just wanna encourage this time, if anyone is a bit of a slower processor or has been kind of working on coming up with a question or a comment, we got about 5 minutes here. And recognizing that it's okay to have a little silence while people are processing. Liz asked in the chat if cursive is making a comeback, and no, you don't have to write your letters in cursive. I promise. No one's going to grade your letters. All right, David, there's a question about your breathing work and how you see those exercises contained within our DD workforce these days. You're still muted here. There you go.
Sorry, I was sneezing earlier. I had to mute myself. I'm not sure what they mean by contained, but how would they use the breathing exercises?
Yeah.
I do it at the beginning of every single class that we teach. And the reason we do it is people come in with all different energies and stresses and things going on in their life. And it's the best way we can kind of just level the playing field, if you will, to kind of bring us all together to a space where we're ready to learn and talk and discuss and share things. And that's why we use it. So I would think it would be able to be used in any kind of community. And part of what pursed lips breathing does is when you're doing a long, slow exhale, like you're blowing out of a straw, you're actually kind of creating pressure in your lungs, and you're helping fill up air sacs, all those little tiny air sacs that don't always get used. We find that a lot of people, or I can say for myself, I sometimes breathe very shallowly. So taking a moment to focus on deep breathing and using all of my lungs is important. I'm a person who also has asthma, and in this time of COVID-19, I think anything I can do to strengthen lungs is important. And then there's something about Help and Hope for Youth there too, I see. And I think the website was shared, but what they are doing is they're really trying to bring mental health education into schools from peers. They're also trying to change the state standards and education standards in Arizona to include mental health education. So they have a few different task forces within Help and Hope for Youth. One is more focused on advocacy, and that is run by a young gentleman. And then there's also kind of the training side of things, and then just the planning side of things. But their Help and Hope for Youth is not just Nami. It's a bunch of organizations signed on to really make this change together. It's in what they call a collective impact model. And the idea is, we can do it together. But please go to their website, and there's lots of information there. And I believe it's partially funded by the Lovell Foundation. And I believe that there's some desire to take this out of the 4 southern counties and really take it to be statewide. So that's pretty darn exciting in my opinion.
Gail shared in the chat in relation to some of the breathing stuff that does a group drumming facilitator and is very familiar with kind of the therapeutic aspects of that as well. I don't see any hand raised in the participants. I don't know, Natalie, if you want to share some closing thoughts, or if we want to give a few more minutes. I don't know what we want to do.
Well, it seems like, make sure there's nothing in the chat. Okay. Donna says, at the University of Arizona Workforce Development Program, I earned the certification for a parent and family specialist. This training reinforced the benefit of some type of relaxation exercise to help people focus. And Hannah gave us a link to Letters to Strangers, another way for folks to reach out while maintaining physical distancing. So that's great. Really glad to see all these resources. And these will be in our FAQ that we keep on our Google Doc. And we'll send out that information to everyone. And it's also, I believe we always have it when we send out the next links for the upcoming calls. So
can I say something real quick? I'm
please,
sorry for interrupting. I just had this thought I wanted to share before we end the call today. One of the big themes today was telehealth, but we know a lot of people still don't have access to internet or the devices required. So over the next few days, we're going to commit to researching funding sources, because we know that there have been community groups and foundations that have set aside money, particularly during coronavirus, for items like this, but we need to do a little research. That will be something that we don't have available right now, but we will include information on that in the Google Doc because it really is a powerful way to keep people connected, not just during this time, but in the future. And so that's our commitment to you. So keep an eye out for more information about ways to get the devices and the internet if you or your families don't have that right now. All right, back to regularly scheduled programming. Thanks, Natalie.
Thanks, Sarah. And Rachel mentions in the chat, especially for rural, low-income, and tribal communities. And we see this here at the Arizona Center for Disability Law that we have a lot of outreach. It's tough to outreach to those areas, so let's keep that in mind. And pursue teaching people how to use technology, because despite the fact, here we are on the Zoom, there's a lot of people, I'll include my dad in this, that just have no idea how, and it can be scary, which for a lot of us, especially a lot of younger, it sounds funny, but it's really not. And it can be an impediment for many, especially if they don't have either, if they're living up in Second Mesa on the Hopi Reservation and they have very poor access, or if they're just so not familiar and feeling overwhelmed. Because I think even for us that do Zoom calls all day, it's exhausting, and we understand, and so if you're not familiar with it, so let's keep that in mind. Okay, so just a few minutes left. Does anybody have, before I start really wrapping up, we have any questions or anything else? I don't think so. Okay. So real briefly, for those who may not know me, I'm Natalie Luna Rose. I'm the Communications and Outreach Director for the Arizona Center for Disability Law. We're a partner with the network here that does this. Now, are we on our 11th, Sarah? Did we say this is our 11th, right? Our 11th session.
Yes.
So almost 3 months of having to, that our world has turned upside down a little bit. So really grateful for all of you who have stuck with us. We will try to keep doing these calls as long as we possibly can. And, if there's things to run out, things to not, we have stopped having issues to stop talking about, we'll stop the calls, but we don't see that happening. So we hope to be able to be the resource for everybody that is here, and tell your friends too. Okay, so I wanted to thank David for his time today. Really appreciate it, as well as Lindsey. Both of you gave very valuable information, and please use them. I saw that they have their contact information in the chat. You can also email Sarah. She also has their contact information as well. And if you have any, again, we'll probably have another call next week, most likely. We've been trying to now kind of keep it, we were bouncing around trying to keep it on Tuesdays now. So if there's not any other questions. Sarah does write in the chat, anyone interested in a Spanish language Zoom resources call, please let us know. That's obviously a community that it tends to not participate as much due to lack of resources. So if you have any ideas, please let us know. And same with our seniors. So again, if you can't, if no more questions, then I think we could wrap up for today. All right, everybody be safe and well, and we'll see you soon.
Thank you.
Thank you, everyone.
Thank you.